Hi all, welcome to this webinar on disability inclusion and monitoring and evaluation. It is great to see so many people calling in from Australia and across our region, so welcome. My name's Karen Clark. I'm the Executive Officer of the Australian Disability and Development Consortium, ADDC, and in partnership with ACFID, CBN Australia and the Pacific Disability Forum, we are bringing you this webinar today. The ADDC, for those who might not be members or subscribers to any of our resources, we have two main objectives. One is to advocate to the Australian government so that they include disability inclusion across their whole Australian aid program, and also to support the Australian sector to include people with disabilities in all programs delivered through aid. You can become a member of ADDC and be invited to more events like this and participate in our consultations and the like, and I'll provide more information at the end. But I would like now to introduce our speakers for today. We have Azel Bush. Azel is a disability inclusion advisor with CBM Australia, a role which includes providing training, mentoring, and technical advice to international aid agencies to help them strengthen disability inclusion in their programs. He includes a focus on disability inclusive data collection, M&E, and implementation approaches across a range of projects in Asia Pacific. Azel has great amount of experience in program quality, M&E, and inclusion roles in the international NGOs, and holds a Master's in Development Studies. So thank you, Azel, for joining us. We also are fortunate to have Liza Verity, who is the Manager of Planning, Policy and Advocacy from the Pacific Disability Forum. Liza is joining us from Suva, Fiji today. Liza has extensive experience working across the Pacific in research, monitoring and evaluation, and project management, working with governments, NGOs and the UN. And in her current role with the Pacific Disability Forum, Liza manages strategic planning in the office, including monitoring the implementation of their current plan with PDF members and partners throughout the Pacific. Liza also manages the policy advocacy within PDF, including focusing on data, budget and legal harmonisation. She has previously done research work and worked with a variety of different actors across the Pacific and international development. So thank you very much, Liza and Azel, for joining us today. And before I hand over to our presenters, I'd like to let you know that you're invited to ask questions throughout the webinar. So there's a question and answer button at the bottom of your screen. You'll be able to see all of the questions that have been asked by other participants. And then at the end, in the last section of our session today, we will have a Q&A session where we will attempt to answer most, if not all, the questions. So thank you, Azel. I'll hand over to you.
Yeah, thanks, Karen. So Azel Bush here from CBM Australia. So today we're going to sort of try to cover a really brief overview at an introductory level around how disability inclusion relates to M&E practice in development projects. It's a topic that we could spend sort of all day covering. In the next 50 or so minutes, we're going to just cover a few kind of key points and hopefully generate some ideas for discussion and some ideas for further action. We've kind of organised our presentation around a few key topics. So the first is around what information would you actually need in order to inform good practice in disability inclusion. Second is what sort of methods would you use to actually go about collecting that information. The third one is around how could you make sure that the processes or tools that you're using to collect data are more inclusive for people with disabilities. And then at the end, we'll have a few ideas of suggested entry points, which might be opportunities for you to start making change in this space. And we'll hold up some questions till the end. And also just to note that the discussion today is, I guess, reflecting our perspectives, my perspective and my colleague Liza, who will be presenting after me. So CBM is an international development organisation, and much of the content we're presenting today is based on our experience of partnering together with other development organisations, including ACFID members, and some of the sort of reflection on the challenges or the experiences that they've had in trying to apply disability inclusion to their M&E work. And Lisa similarly will be sharing her perspectives as a representative of disabled people's organisations in the Pacific. So that's today, but let's get started. So first, why collect data on disability? And I guess I'm sort of assuming that everyone is here joining this webinar because you already think it's something that you need to do, or maybe you think it's something that's really great and you're trying to drive change in this space. So we won't go through all of these messages here. And I just wanted to kind of focus on two messages here. One is, you can see from this list on the screen, there's a lot of reasons why you might focus on collecting data on disability or focus on disability inclusion within your M&E practice, which is great, but we've deliberately left the last one to the end, which is on reporting and accountability, not because it's not important, but really because we're often seeing that the goal of meeting on reporting requirements, particularly to donors such as DFAT, who are really driving this agenda, is often kind of the starting point or the entry point for organisations to be engaging in this space, which is really great. But we want to just emphasise that there's all these other kind of goals which your M&E practice could be contributing towards, and don't want you to lose sight of the breadth of what could be achieved through some good M&E practice. And then the other message was that we hope today not to just emphasise that collecting data on disability is important, but also that it's important to take quite a careful and deliberate approach to the way you go about doing that. The types of considerations that we'll be discussing today will have an impact on whether any of these objectives that are up on the screen could actually be achieved. So with that in mind, let's launch into the first of our topics, and we're going to be using the online poll function in Zoom today. So we'll have three questions for you. This will be the first one. We'll give it to you in just a moment. And basically, we're giving you a really simple scenario and asking you to choose from one of 4 options. And you might see that some of the options, or at least one of them, might represent what you think is the ideal answer, but we're not asking you to choose what you think is the correct or ideal answer. We'd really like you to sort of answer based on what's your current reality. So either what you're already doing in this space, or what you think could be feasibly done, either in your current role, or what would be feasible within your organisation's context. So let's get into the first one, and hopefully we won't have any technical issues with this. So very soon, I think you should be seeing a poll option pop up on your screen. And basically the scenario is this. So your colleague is designing a new project and has asked for your advice about how to approach disability in the project's M&E framework. You tell her to, and you'll have to choose one of these options. A, make sure that beneficiary monitoring data are disaggregated by disability, since this is DFAT's requirement. B, disaggregate monitoring data and also collect data on disability in the baseline and endline surveys so that you can track changes for this group. Option C, collect disaggregated data and also add some indicators based on what you hope the project will achieve in terms of disability inclusion. And option D, use the situation analysis and baseline processes to better understand the situations of people with disability in the project context, and then update the project design and implementation strategies based on this information. You will then update the M&E framework around this understanding. So take maybe 30 seconds to pop in your answer. And then once that's done, we'll be able to share the responses with you. And just, yeah, don't necessarily choose the right one. Choose what you think is feasible or realistic for your organization. We've just got a few more votes to come through. All right, let's slow down to a trickle. So let's close this off. Okay, so there's a pretty clear favourite here. But I guess what we wanted to sort of raise with this scenario is firstly that disability inclusion is more than just counting people. So the first two options there were sort of very much focusing on counting people or disaggregating quantitative data. But obviously, the way that disability could be applied in monitoring and evaluation is much more than that. And what we really want to know is things like how, what is our understanding of the situation of people with disabilities? What sorts of barriers are they facing to participating or benefiting from development? Are we getting equal outcomes for those people? Are they participating in the same ways as other members of their community are participating? So option A and B, I'm glad some people kind of put up their hand to choose those options, because that's kind of what we've seen a lot of in the sector, particularly given that that's a requirement under large grants like ANCP from DFAT. But I guess the challenge with that is that while we're seeing often seeing good practice in terms of using more sort of robust methods to collect that data, there's not always the same focus on measuring other aspects of disability inclusion beyond that, or understanding those or reporting on them. So for example, there might be project reporting that discloses numbers of people with disabilities who benefited, as well as numbers of people without disabilities. But then there might not be that sort of analysis or discussion of some of those more, I guess, the more meaty aspects of have those people really have the same types of outcomes as other people. We're also sometimes seeing that disability is kind of added on to a project. Maybe it's a cross-cutting strategy, or maybe it's something that's added on after the bulk of the project design is completed. And then maybe it's not really reflected as strongly in M&E frameworks or tools as it could be. So option C on the screen there is maybe something that could be done to make sure that disability is actually measured through M&E and actually included as part of the objectives of the project. But I guess what we're really advocating for is something like option D. So what we'd really like to see is that the first questions that are asked before you design your M&E approach, or before you think about how disability should be integrated into that, is to really spend some time understanding what the situation is for people with disabilities in that particular context, and developing quite clear strategies or a theory of change for how you're going to engage with that sort of situation. And then after that's done as a first step, design your M&E to really track that. So that might be developing a few indicators, or it might actually be something more comprehensive in terms of splicing that into your project log frame or theory of change, and then designing your M&E framework according to that. Okay, thanks everyone. So okay, so I think if that box hasn't already closed, please do close the poll box and we'll move on. So the next screen, which hopefully you can see on your screens now, is a really simplified kind of idea or suggestion of what might be a starting point for thinking about what information you might want to collect through a project relating to disability inclusion. And I guess a few points around this is that obviously what information is needed to monitor and evaluate disability inclusion outcomes is going to vary depending on the sector. Or vary depending on your objectives and what you've defined as your goals for engaging in disability inclusion. It's going to vary depending on the stage of the project cycle that you're at, and where your organisation's at in terms of scale, or in terms of your confidence of engaging in this space. So that's just, I guess, a message to emphasize that there's no kind of one size fits all checklist. But here's some sort of generic guidance for how you might start developing a contextualized framework for your project. So in terms of the project design phase, some of the key questions are, what are the situations of people with disabilities in this particular area or in relation to this particular sector? Who are they? Who are the relevant stakeholders? And what are the barriers that are faced by people with different types of disabilities? Which, so there's often assumptions that all people with disabilities have the same experiences, but good M&E would be able to break that down a little bit and kind of start developing more customized strategies for how you engage with diverse people. And then during the during the project, how do you know if your disability inclusion efforts have been successful? And we've got three kind of, guiding questions here, which are really based on DFAT's definition of disability inclusive development, which kind of emphasizes that disability inclusion it's not just about getting good outcomes, it's about the process as well. So making sure that processes that get you to your outcomes are inclusive, accessible, and create space for people with disabilities to be participating. So the questions that you could be sort of looking for from your M&E would be, are people with disabilities involved in the planning, the implementation, and the monitoring and evaluation of your project? Have barriers to inclusion been identified? So do you understand what it is that's preventing people with disabilities from being included in whatever type of project or service? And have you put strategies in place to actually remove those? And that's really what we define as disability inclusion. It's removing the barriers that people with disabilities are experiencing, and then so that they're able to then participate and benefit on an equal basis. And then finally, the question of outcomes. So are people with disabilities benefiting from the project or the service on an equal basis to others? So there's a consideration of comparing outcomes across different groups, which can be quite technically challenging to do in a project context, but let's talk about that in a moment. Okay, so let's have another poll. So same scenario, hopefully, yeah, here we go. So your colleague is now developing the detailed M&E framework for the project and has asked for your advice on specific M&E tools to use. You tell her to A, make sure the baseline survey and activity monitoring tools ask whether participants have a disability so that data can be disaggregated. B, include the Washington group questions in the baseline survey and monitoring tools, since this will help the project team identify a wider range of people with disability than just asking if they have a disability. And you email her a copy of the questions. Option C, prioritize qualitative methods such as personal stories, focus groups, interviews. This will give a better picture of whether the project has helped achieve meaningful change for people with disabilities and will be less resource intensive than collecting quantitative data. Or option D, use a mix of quantitative and qualitative methods. You also recommend to your colleague to consider training the project team on how to communicate with people with disabilities and how to use tools such as the Washington group questions, as well as recommending that they support them to analyze and use that data. So please lock in your answer based on what you think is feasible in your organization context. Just allow another 15, 20 seconds to vote. Okay, most people have voted, so let's close it off. Oh, a few last minute ones came through. Okay, so here's the results. So again, I guess quite a resounding number of people going for what we kind of hope or what we're advocating for as the ideal response to this question, which is option D. but I guess just to say that there's a whole mix of practice within the sector in this space. So the first two options we're talking to sort of quantitative data or disaggregating data by counting numbers of people and disaggregating that data by people with and without disability. And I guess this is really important, and particularly if you're trying to compare outcomes between different groups. But we're also really aware that it's quite challenging to do that well, particularly in a resource-constrained environment. So option A was asking about giving the idea of asking the question, do you have a disability? So all our experience shows that that's likely to be very inaccurate. So you'll only get a very small percentage of the population and a small percentage of people with disability within that population who would actually answer yes to that question. The Washington Group questions, which we'll just briefly introduce in a moment, are a much more robust and accurate way to do that. And they're definitely the recommended way the recommended tool that we're recommending to NGOs to be using in order to identify people with or without disability. But they do need a bit of investment in supporting the quality of the way that those are rolled out, training staff, testing translations, all those sorts of things. So the idea in option B that just emailing a copy of the questions to a project team, that in our experience, it hasn't always resulted in getting really good data or really useful data. So there's a risk of sort of creating work for people without actually getting a benefit from that. So getting the info that we really want to know about disability inclusion in terms of, what are the barriers that people face, and are people really having meaningful participation in our projects or in services or in their communities, actually requires qualitative information. It requires talking to people with disabilities, talking to disabled people's organisations, DPOs, talking to other stakeholders in the community in the disability sector. Definitely we're recommending something like option D, so using a mix of both quantitative and qualitative. And yes, quantitative is often, I guess, seen as a requirement in terms of reporting, but qualitative information, even just doing a small selection of focus groups or interviews, can provide really rich information. It's quite cost effective. It's low cost to conduct interviews and those sorts of things with a small sample size. And can give a much richer picture of the types of the more substantive questions that we're trying to answer, that give you a real sort of, I guess, a bigger picture of where a project's at in terms of disability inclusion. Okay, let's move on. Okay, so if you can close that poll box if you haven't already. So how do you collect information about disability? And obviously this is a really broad topic that we're not going to do justice to today. And this is just some example of different sort of sources of information or methods that can be used. So in most places you'll find there's a lot of existing information about disability. So that might come from government agencies, disability service providers, community-based rehabilitation networks, or disabled people's organisations. And all of those types of institutions might have a database of some sort which identifies people with disabilities in a particular area. It's also quite likely that those databases are incomplete. They might represent just a very partial picture of who's really in the community. So it might be people who've formally registered in order to access some sort of service, rather than being based on a broad sort of reflection of the population in that area. So the next point is around adapting your existing tools. So it's not the case that you need to sort of go down the path of developing really specific types of specialist tools to collect good data on disability. Using your existing types of tools, whether they're sort of household surveys, individual surveys, focus group guides, all of those sorts of things I guess it's actually our recommended approach for how you go about doing good data collection, but making sure that you add relevant questions into those tools. So we're often, I guess, seeing the design of baseline surveys, for example, which have a really detailed kind of and considered approach to collecting information specific to that sector that the project's working in, but haven't maybe thought that much about what they really need to know around disability inclusion. So just adding in a few sort of considered questions into a tool like that would go a long way to sort of getting really good information. And then the other point is to make sure that diverse people with disabilities, so people with different types of disabilities, both men and women with disabilities, people in both maybe urban and rural contexts who have very different situations, are actually consulted through those processes. And that means, you know, sometimes being quite deliberate around sampling. So in all the sort of studies that we've seen, unless you're quite really specific and deliberate and take extra efforts to try to reach people with disabilities, it's quite likely that your sample won't really be reflective of the community. So you might just have a few of the more, maybe it's more educated or people with disabilities who are participating, or maybe it's people who are already kind of leaders within their community. But reaching the people who are most marginalised actually requires quite deliberate approaches. So both qualitative and quantitative methods useful. Disaggregating data is really useful. So data can be disaggregated from surveys or monitoring forms or beneficiary registration sheets, sign-up sheets for various activities. And in order to do that, there's some recommended question sets. The Washington Group questions is one of those, and we'll introduce that in just a moment. There are some disability-specific tools out there. Usually they're specific to a particular sector. So things like accessibility audits are designed, they're used in the WASH sector quite a bit to evaluate the accessibility features of infrastructure. And then the last point is around working with government to improve disability inclusion within their data collection systems. So for example, if it's a health sector intervention supporting health clinics, or a health ministry to integrate disability into their health management information system, which would avoid having to sort of duplicate that process through an NGO M&E system. So getting to the point of disaggregating data, we just wanted to really briefly introduce, for anyone who doesn't know it, the Washington Group questions. There's actually several sets of questions, and the one that's on the screen right now is the short set of questions. And it's really the, it's the quickest and easiest way to get an approximate understanding of who might have a disability within a population group. So if you can't ask someone if someone has a disability, which we definitely recommend you don't, because the data is likely to be inaccurate, and it's also could cause stigma, shame in asking that question. This is the alternative. So instead of asking one question, there's 6 questions to be asked, and you can see them up on the screen that they all relate to kind of difficulties which a person might have in their everyday functioning. And there's 6 different domains of functioning that are assessed using these questions. They're designed for statistical surveys, so big population studies, censuses and that sort of thing. But there's a lot of experience in trying to adapt them within NGOs. So for example, we've seen a lot of NGOs adding these questions into baseline surveys, which enables them to identify where people with disabilities are living. It enables them to compare the situations of those households compared to other households by disaggregating all the different other data points within that baseline survey. And then it also might allow them to actually do some follow-up with those people who identified. Some organisations are using them more informally, so they're just using them as a guide for talking about disability. So training their staff that instead of just using the disability language, maybe they should use this as a framework for having discussions around disability, because you'll see that the questions are designed to get at this issue of disability without actually using the language of disability. And they've also been used in some projects to determine eligibility, for example, for subsidies or voucher programs where there's some sort of a concessional benefit for people with disabilities. So these are used as a tool to screen for those people. So 6 questions, and all 6 of them have to be answered. They have to be carefully sort of translated into local languages, and they shouldn't be changed at all. And for each of the question, there's 4 response options. So they're not yes or no questions. And so they're assessing a scale of difficulties that a person might have in relation to each of these 6 domains. And then the recommendation for who gets counted as having a disability or not is that anyone who answers either 3 or 4, so yes, I have a lot of difficulty, or 4, I cannot do it at all, in response to any one of the 6 questions, those people would be counted within your data collection as having a disability. And typically we might see in a population somewhere between 5 to 12% of a population would be identified using this tool. So it's not perfect, it doesn't identify everyone, but it's a good compromise solution for what could feasibly be done in an NGO context. And the other message is that this is for the purpose of collecting data, but it doesn't mean that you're identifying people as having a disability. They're not being labelled or formally recognised or diagnosed as having a disability. And it's really important to give training to staff around that. So that was a very brief introduction to the questions. We'll share with you some online training on this. There's a whole lot of resources. You can go do a 3-day training on this tool alone if you're that way inclined. But hopefully, at least it's you're aware that this is something that's being used quite widely within the sector, and there's a lot of experience in learning around what works well and what doesn't work so well in using these types of questions to identify people for data collection. Okay, so let's move on to one final poll. So your colleague has drafted terms of reference for the baseline study and has asked for your advice on how to make the study more inclusive of people with disability. You tell her to A, specify in the terms of reference that people with disability should be included within the survey sample and focus groups. That will ensure that their voices are heard. Option B, specify that diverse groups of people with disability should be consulted through the baseline and that accessible tools and processes should be used wherever possible. C, invite local disabled people's organisations, DPOs, to be involved in the baseline process as advisors, trainers, or in other roles, and you specify this in the TOR. Or D, allocate time and budget to develop accessible tools and processes in consultation with DPOs. You advise this might require an approach to capacity building for M&E staff in terms of disability inclusive methods, and also for local DPO members in data collection methods. So please lock in your answer in terms of what you think is feasible or realistic for your context. Maybe just another 10 seconds to choose an answer. Okay, let's, yep, a few more coming through. Let's close it off. Okay, so again, really glad to see that people are kind of switched onto this, and I hope that options like C and D are actually realistic and feasible for your organisation, and that you're already doing this really well. And I'm going to pass on to my colleague Lisa to have a bit of a discussion around ways in which M&E processes themselves could be made more inclusive. So over to you, Lisa.
Aisel, please, and thank you, Bulavinaka from Fiji. It's great to join the panel here and be able to share work around how we can be more inclusive in terms of project M&E. And for all those that ASL that has shared before is at the organization we use the tool, the Washington Group short set to disaggregate, especially around project work that we do. But before I very quickly touch those points on the screen, maybe just to give us a little bit of who are Disabled Persons Organization. So the Pacific Disability Forum, we are a membership organization, and we have a membership across the Pacific. With National Disabled Persons Organization, it also includes Australia and New Zealand. And this National Disabled Persons Organization, most of them represents cross disability in country. That means those with physical impairment, those with visual impairment, hearing, and those with intellectual disability or psychosocial disability or even deaf blindness, if there are membership. And DPOs, a definition of the DPOs or Disabled Persons Organization, they are governed by the board, should be almost more than 70% are persons with disabilities themselves. And so in the Pacific, there are a few countries, maybe one or two, like Fiji, who has single line Disabled Persons Organization. So we have an organization for the deaf. We have an organization with those with physical disabilities. We have an organization for psychosocial disability. We have an organization for those with visual impairment. And we have a federation, an umbrella. And the other countries, most of them have established those single line DPOs, but they come under the big umbrella of the national DPOs. So one of the key discussions when it comes to project M&E, or even in the design and gathering for a project, when it comes down to data collection and gathering, how do we, the important to recognize the different impairment needs. And so in data collection, you will have to consider those who are not able to, those with visual impairment or those with very low vision. So how do you make things accessible to them if you're collecting data or sharing information, whether it's a hard copy, it does not work, but how can you make it accessible if you have to do it online? And you have to think of, if you're working with communities who have deaf members, so there's always a need for sign language interpreters. And if you're working with communities that has participants or beneficiaries who have psychosocial disabilities, how do you relate with them? And we have with a physical disability. So you think we always have to think about accessibility in all its form, accessible information, accessible infrastructure, accessible communication. So it enables everybody to participate, bearing in mind the diversity of the disability communities themselves. Sometimes we have to, because in the Pacific, most of majority of our population are in the rural areas. It's not only specific to disability, but across in the work that we do, the respect for cultural sensitivity. You have to recognize traditional protocol. And these are some things that you can always talk about or discuss first when you get in touch with a disabled persons organization. Sometimes you might not engage the DPOs, the office itself, but the communities that you work with in terms of the project has disabled, there are members, disabled persons that are part of the DPO. The other one is that for us to always recognize and respect the participant space and availability. Where are they comfortable to be part of the discussion or the project, whether it's a focus group discussions or whether we want to organize a workshop to bring everybody. And when are they most available? because sometimes we also recognize that we take them away from be the livelihood that their chores. They have to think of a time, maybe there are little children that they look after. So the discussions and the engagement from the beginning to ask when is it most suitable for if we need to gather them as a group or even to see them individually. Of course, language is a barrier in the Pacific. Most of the things, project work are done in English, and English is our second language. From our experience, you'll always need an interpreter, especially if you want to gather information or engage with grassroots communities. Always need English translator to the native and back, and vice versa. These are some of the things we'll always have to keep in mind. And how can, if you're part of the project, the capacity building, so they can meaningfully participate in the project M&E from design all the way to evaluation. Because sometimes we come in with a project, they have no idea what it is. So it's a little capacity building for them to understand what it is and how does it relate to them in their everyday living. Why is it important for them? How does it impact them? And of course, the follow-up that follows afterwards. Can we move to the next slide? So contact the DPO, find out about the organization, how you can engage. Talking to one person with disability does not represent everybody. Sometimes always a thinking, if we talk to one person, it's everybody. That's why it's always advisable to talk with the organization. And of course, we are spread across the Pacific. So it's either want to engage with them, you can engage with them directly, or you can engage with them through us, or even with CBM Australia, who we also work closely with our members across the Pacific. The next slide. Can we move to the next slide? And these are some of the entry points for actions. Consult DPOs early on and establish ongoing working relationships. This is to identify barriers, resources imbalance, power imbalance. It's very important to allocate or advocate for additional budget to cover accessibility, especially if you have to do focus group or gather people. Most of our infrastructure in the Pacific is not accessible. Physical accessibility, it is not accessible. So how to make sure that it's accessible, the infrastructure. You'll need interpretation. You will need sign language interpretation and interpretation from English to vernacular and vice versa. You'll need to advocate for budget, like to cover transport, because if you want to gather them at a particular point, if most of them, some of the group, like those with physical disabilities or wheelchair users, we don't use the public transport because it's never accessible. So it costs more for them to get into the meeting place from our experience. The need to raise awareness and build understanding on disability inclusion during monitoring visits. You can arrange training for colleagues, enumerators, consultants, and partners, etc. And always plan for accessible processes and allow for extra time. It's also their support people with disability to take part in M&E roles, providing training, coaching, and even reimbursement. In terms of like for the process, we already have started to work with our membership on the Washington group questions. So some of them do know, because we know asking, if you just ask if you have a disability, it's always underreported because of the stigma, and people will never self-identify because of the stigma associated with it. That's why we advocate and we strongly suggest the use of the Washington group question short set. And there's an extended set if you want to know more, but there's a whole lot of resources and training that is available. And to specify inclusive methods and processes in TORs, and how do we revise the M&E project management process and tools so it's inclusive of all those that we have shared from the top, the different impairment, the accessibility needs, the communication and the information, and all these other points of entries for action that could actually help us as partners to engage, to ensuring and making sure that our project and M&E work is truly inclusive of persons with disabilities, and always to recognize that persons with disabilities have their own lived experience, which is rich in information and rich in knowledge that only them will be able to talk about it or to share. So, and also it goes back to one point I raised earlier, cultural protocol, etc., that we have to be mindful of. And that's why the point raised to always start with a disabled persons organization. Thank you, Aisel. Is it next?
Yeah, thanks so much, Lisa. So that's basically bringing us to the end of what we plan to discuss today. And just a reminder that if you do have questions while we're looking at this slide, please open the Q&A function on Zoom and type in any questions that you want answered. There's 2 in there right now, which we'll move to discussing. But before we do that, up on the screen, there's just a few links, and I think we'll share a few more with you after the webinar by email. So Lisa's organization, the Pacific Disability Forum, is the first one. My organization, CBM, is the second one. didforall.com.au is a collection of curated resources organized by different sector, all on disability inclusion. One of the themes that are covered in that resource is around data and M&E. So you'll find some resources there. And then also just a big thank you to everyone and a message to please reach out to us and get in touch if you have any more questions. And if there's more coming through right now, we'll try to answer what we can, or else get back to people after the webinar. Thanks.
Thanks, Aisel, and thanks, Liza, for those really informative presentations. So to jump now to our Q&A session, our first 2 questions that we have both relate to the Washington Group questions. So as Aisel said, please do ask any questions that you have through the Q&A function in Zoom, which when you hover your cursor over the bottom of your screen, it should pop up. It's one of the options. So to go to our first question, it's from Alex. So thanks, Alex. So in relation to the Washington Group short set of questions, Alex has asked whether it's recommended to add a question on psychosocial impairment.
Yeah, I mean, there's not just one question about psychosocial disability. There are longer question sets from the Washington Group, which include a range of questions. There's possibly another 8 or 9 questions in there that relate to psychosocial disability, and all of those need to be used. Because it becomes much longer, the full question set from the Washington Group methodology is 20-something questions, I forget. And there's also additional modules that are adapted for working with children, or for asking questions relating to children. And there's a couple sector-specific ones that are being developed at the moment. And I guess in terms of what's feasible within a project context, if getting a better understanding of psychosocial disability is something that's feasible, then we definitely recommend using those questions, but also being mindful of being able to actually have the capacity to respond and include those people. So I guess bearing in mind ideas around do no harm principles and being quite deliberate about the way you engage with people who might be particularly marginalized within their communities. But if that's what you're planning to do, then yes, definitely recommend asking questions like that.
Great. And our second question also relates to the fact, the question of whether you mentioned that the list that you had was the short set questions. Do you know if there's any other that will actually drill down into a specific disability?
Yeah, so there are other tools that are much more comprehensive and coming from a sort of a medical or health sector perspective in terms of comprehensively assessing different types of disability. And that's really something that's done by healthcare professionals, doctors, rehabilitation professionals. In terms of sort of M&E and data collection, there is the Washington Group, the extended set, which has the 20 to 30 questions in it. And that does, if you look through, it does have specific questions relating to different types of impairments, but it's not in itself a tool for actually identifying a particular type of impairment, because that's a medical process, that identification.
The next question we have is from Kylie. So thanks, Kylie. And she said that we found the Washington Group questions to be very time consuming to administer when working with large groups and have the possibility of being intrusive. So do you have suggestions on how to collect disability information in workshops that work well with tight programs?
So I think there's been testing of the Washington Group questions, and the Washington Group itself in their own testing found that on average it takes 1 minute and 15 seconds to ask the questions, with the range being sort of between, I don't know what it was, 30 seconds up to 3 minutes or something like that. And they have even been used in humanitarian contexts as well, where there's really particular time pressures. But I think perhaps this question is thinking about when you're doing a more like a workshop or a big kind of community-wide activity where you might have a large number of people coming and it's not possible to collect data from each individual person. And in that case, I think the best approach is that, I mean, it's not really feasible. You can't do it. So do what's feasible within your context. And whenever there's kind of household level data or individual level data, use the tools to collect that data. And if you've got a small group or a database of people who are involved as participants in a project, then maybe you collect the data once at the time that they sign up or register, and then you're able to cross-reference that database whenever those people participate in a project, rather than having to collect the data every time. But yeah, for a big workshop, big community-wide activity, it's not really possible.
And Lisa, do you have a comment on PDF, who you said have used the Washington Group questions in terms of the questions we've just said?
We do use Washington questions. So it's I think for us it's the understanding of how it has to be implemented, because when we tested and we were engaged with the members, it's not like, okay, we wanted to know if you have a disability or not, but the question is asked across everybody, because it's a functional, it's about the difficulty of you doing a universal activity, like can you hear, can you see, can you communicate, can you walk, or can you do self-care? And for us, I think there needs to be capacity building on how the question needs to be implemented, and what is the understanding according to, like for the Washington Group, if the response is at a lot of difficulty and cannot do at all, that is the identifier for you being a person with disability. That's the identifier for you being a person with disability. So we kind of set it up in a matrix, like those 6 questions and the responses, and then we ask. So we are collecting information and finding difficulties in doing these certain activities that we are asking everybody. And so, do you have difficulty seeing even if you're wearing glasses? And some of them would say, oh yeah, I have a little bit because I use reading glasses. And you might come across, I have a lot of difficulty because I can't read normal font 12. And you would know those who say, yes, I cannot see at all because I am blind. And then I see the questions around psychosocial disability is asked a few times in the threads that have come in. Yes, the Washington Group questions is recommended. It's used in statistical surveys like census. Those 6 given this of the population who's at risk. So it comes down to how the question is implemented. And then who is, the identifier is if you respond as a lot of difficulty or you cannot do it at all, then you are a person with disability. But if you ask upfront, you say, oh, we are asking this set of questions to find out if people have disability, people will not self-identify because of the stigma associated with it. And that's from experience with the work that we do. So there is a protocol on how the question needs to be asked. Thank you, Karen.
Thank you, Liza. And as an extension of that, Liza, we have another question that's asked, how do you recommend reaching people in hard to access areas to ensure their data is included in surveys or focus groups? So do you have experience of that in your work?
Okay, yes, we do all the time. Like hard to reach, if it has to do with accessibility, then working with them in terms of focus group discussion might not be, it's going to be difficult, but you're able to, it depends on if we have put in resources to be able to reach hard to reach community. It goes to this from early stage. You have to put in to help in the remote to think of question and information as well. So you can, if it's part of in the project itself.
Thanks, Liza. And I think we just dropped out of a little bit of audio as well just then, but I think we captured the heart of what you were just saying in response to that question. So I'm going to throw one more question to Aisel, because I think we have time for just one more. So in project M&E planning, how do we capture the additional, in brackets, costs required while working with people with disabilities? This would help in future project planning.
Yeah, it's a good question. It's also a really tough one to answer because the costs involved vary so significantly across different contexts. So for example, you can imagine, working in a remote or rural area compared to working in a big urban settlement would be very different. There's not really guidance, or not really clear guidance on that. And I guess what we would recommend is, if you have the flexibility within your organization's budgeting processes to have like a sort of contingency budget where maybe it's a bit flexible, it's not necessarily all going to be spent, but it's there, it's available to be used to make the adaptations that are required. That's really great. I know that's not possible in some organizations. You might need to actually come up with an actual sort of concrete estimate. And there's not, I mean, there's no guidance on how much it costs to do sort of inclusive M&E processes. And there's very little clear guidance on even just doing inclusive programming general. Estimates range from about an additional 3% of the budget up to maybe sort of 5 to 10% for doing a more comprehensive thing. And then if you start looking at changing infrastructure, you get more than that. But for M&E, maybe you can look at the 3 to 5% range on top of your existing M&E budget.
Thank you, Aisel. And look, thank you, Aisel and Liza, very much for sharing your expertise with us today, and also Vicky from ACFID for organising the logistics and making the technology work so well. We are out of time today, and if we haven't got to your questions that you've asked, we will endeavour to actually contact you and give you a response as well. I will reiterate that we'd love you to become a member of ADDC, which is free, if you would like to be invited to similar learning events and also to receive our monthly email of news and resources from the sector. This webinar itself will be available online, and we'll send a link once it is up with captioning as well included. We'll also send around the PowerPoint slides for your reference and the additional resources that Aisel has mentioned, plus some others to help you in your future work. I definitely encourage you to stay online now. So once the webinar has closed, to complete a survey. The survey will include general questions about how you found this webinar to help us in future planning. But really importantly, we'll also ask you to suggest what future topics under disability inclusion you may like to see. All our questions were around the Washington Group questions, so if that is something that you would like further exploration of in a webinar or potentially a face-to-face event, please do stay around for the survey and complete it for us. So once again, thank you very much, Aisel and Liza, and thanks everyone for joining us.